Dear friends, when India started to see a sign of relief from COVID-19, another outbreak created amongst people. Various Indian states, namely Madhya Pradesh, Kerala, Rajasthan, Himachal Pradesh, confirmed the cases of bird flu. In Gujarat, Junagadh's Kharo Reservoir, 53 birds were found dead recently. However, in Rajasthan, over 170 birds were reported dead. On the other hand, Kerala was put on high alert after the bird flu news was confirmed in two of its districts. In Himachal Pradesh, around 1800 migratory birds were died. So, viewers, let's come and know more about bird flu or avian influenza from the video prepared by Veterinary Plus and Dr. Nirakara Jena, Senior Veterinary Doctor of Odisha in India. Bird flu is also called avian influenza, is a viral infection that can infect not only birds but also humans and other animals. H5N1 is the most common form of bird flu. According to WHO, H5N1 was first discovered in humans in 1997 and has killed nearly 60% of those infected. Let us know what causes bird flu. Although there are several types of bird flu, H5N1 was the first avian influenza virus to infect humans. The first infection occurred in Hong Kong in 1997. H5N1 occurs naturally in wild waterfowl, but it can spread easily to domestic poultry. The disease is transmitted to humans through contact with infected bird feces, nasal secretions, or secretion from the mouth or eyes. Let us know how bird flu spread among the birds. Bird flu spread between birds by direct contact with nasal and respiratory secretions from the infected birds, direct contact with infected bird feces, contamination of feed and water, contact with contaminated equipments and humans, lack of energy and appetite, gums and wattles of chickens turn purplish, there is discharge from the nose, there is coughing and sneezing, swelling of head and legs, and diarrhea. Similarly, in case of humans, H5N1 infection has the following symptoms. They are cough, diarrhea, respiratory difficulties, fever, headache, muscle ache, malaise, running nose, and sore throat. H5N1 has the ability to survive for extended period of time. Birds infected with H5N1 continue to release the viruses in feces and saliva for as long as 10 days. Touching contaminated surfaces can spread the infection. So, a poultry farmer, a traveler visiting affected area, exposed to infected birds, someone who eats undercooked poultry or eggs, a healthcare worker caring for infected patients, a household member of an infected person are always in risk for infection. Currently, the best way to prevent infection with avian influenza A viruses is to avoid sources of exposure whenever possible. Infected birds shed avian influenza virus in their saliva, mucus, and feces. Human infection with bird flu viruses can happen when enough viruses get into a person's eyes, nose, or mouth, or is inhaled. This can happen when viruses is in the air and a person breathes it in, or when a person touches their mouth, eyes, or nose. People who work with poultry or who responded to avian influenza outbreaks are advised to follow recommended by security and infection control practices. The following advices should be strictly followed during the outbreak of avian influenza. There, as a general precaution, people should avoid wild birds and observe them only from distance. Avoid contact with domesticated birds that appear ill or have died. Avoid contact with surfaces that appear to be contaminated with fishes from wild or domesticated birds. Avoid visiting poultry farms, bird markets, and other places where live poultry are raised, kept, or sold. Avoid preparing or eating raw or undercooked poultry products. Practice hygiene and cleanliness. Visit a doctor if you become sick. Don't eat half-boiled eggs, undercooked chicken. Other than this, don't eat half-boiled eggs, don't eat undercooked chicken, don't come direct contact with birds, don't keep raw meat in oven, don't come direct contact with raw meat. Apart from this, you must also avoid touching dead birds with bare hands. You must wash your hands more frequently. It's important that you take care of personal hygiene, maintain the cleanliness of your surroundings. For extra precaution, try to use a mask and gloves at the time of handling with raw chicken or chicken products. Eat only completely cooked meat and meat products that is at 100 degrees Celsius. Prevent exposure from sick looking sluggish chicken. So viewers, don't be panicked during bird flu. By taking the above described precautions, one can remain healthy. So Battle Plus wishing you all a healthy life. Thank you all.